Welcome to the Voices of Healthcare Equity. I'm Kim Tranquata, founder and CEO of the Healthcare Alliance for an Equitable World, and your host on this journey. Our organization, driven by clinicians, is on a mission to address global healthcare inequity using telehealth solutions. Together, we're building a community of healthcare professionals committed to making a scalable impact on global equity. Join me in insightful conversations with global health innovators as we explore the current and future state of healthcare. Be a part of this mission. Let's create lasting change together. Today, it is my great pleasure to introduce Dr. Makda Majette. Dr. Majette is a board-certified family medicine physician with a strong commitment to public health. She earned her Doctor of Medicine degree from the UNC-Chapel Hill School of Medicine and the Master of Public Health from UNC, Gillings School of Global Public Health. Her training was completed at the University of Miami Jackson Memorial Hospital Family Medicine Residency, where she graduated with a teaching award. She has a passion for mentorship and has achieved awards recognizing her contributions, including the prestigious Emory University 40 Under 40 Award and Top 20 Under 40 for Brickell Magazine. Woo!
Thank you.
You're welcome. She enjoys speaking to high-achieving professionals who may fall into the success trap and find themselves joyless and burnt out. She's a professional speaker with expertise in self-care, wellness, and appreciating joy in life. And she is my friend and a classmate in the Entree MD Business School. It is my pleasure to welcome you to the podcast.
Oh, thank you so much for having me, Kim. I've been wanting to get on your podcast, and I've listened to previous episodes, and you're just doing such amazing work all over the world, and it's just an honor to be here with you.
Oh, we're going to have so much fun sharing all the great things you're doing and how you're contributing to this healthcare equity space. Before we begin our conversations, I always like to give our guests the ability to put forward any disclaimers or identify any conflicts of interest.
I have no disclaimers or conflicts of interest.
Awesome. Well, excellent. Let's get our audience to know you a little bit. Can you please let us know a little about your background and how you came to be involved first in healthcare, but then also in public health?
Yeah, so thank you for asking that. I haven't really talked about how I got into healthcare, public health in a little while. You know, I commonly would answer that question when I got into medical school and residency, but it's been a little while. So what really moved me to practice medicine was one, of course, that you hear this a lot, but you try to work on your strengths. So I was always someone who valued conversations with people and getting to know strangers or people of all different ages and learning about their lives. And I really wanted to find a career where I would get to do that and improve people's lives in a way. So my first career I was thinking about, so my dad was a diplomat. So I grew up part of my life I was born in Kenya, but they just happened to be there at the time. My mom is from Ethiopia in East Africa, and my dad's African American. And we came to the States when I was 6 months old, but then when I was around 5 or 6, because of my father's work, we went to South Africa. And I was there for 4 years. And my last year was during the inauguration of Nelson Mandela during his presidency. So we were there during the last year of apartheid, and then we were able to see the change in the country. So at a young age, I was really able to see that, and I was able to feel that spirit of hope and joy and resilience. And I even remember like attending the inauguration and seeing Nelson Mandela and his smile and his joy and everything he had went through. He didn't carry it with him. Although he had been imprisoned and had these negative experiences, he was still able to forgive and focus on unity and moving forward as a country. So those were the things that really impacted my childhood. And then when I did come to the US shortly after that, so around 94 and 95, I came to the US. Those memories and those experiences still kind of lived with me. And I knew I wanted to use my talents to give back in some way. So medicine was always a thought of something that I could go into. And then what really pushed me, I was also thinking of international work or diplomacy and things because that was the field that my father was in. And we also had that travel experience. So I was between the two. And then when I got into undergrad. So I was in college and I was an international studies major because I was leaning more to the international studies. But I was also doing the pre-med at the same time because I didn't want to cut any of them off. And I didn't do well in I'm taking this answer pretty long, but I didn't do well in my first biology 101 class for the pre-med students, which was supposed to be a weed out class where, of course, it's a lot of people in the class. And they said, not everyone is going to, first day, they said, not everyone is going to pass this class and not everyone's going to be able to be a doctor. And I didn't do well in that first semester of the course. And when I did not do well, it made me think, well, can I still really do this? Is this still a possibility for me? Because prior to that, most things came naturally. I was just doing well on the course and, on the course of my career. So I had a meeting with an advisor after that one course, and I was doing well in most of my other courses. And they said, well, you really need to have a high GPA if you're going to go to medical school. So you should consider something else. And I was already also doing the international studies. So I leaned into the international studies. I still did some of the pre-med requirements, but I wasn't like determined to, take my MCAT and everything by the time I graduate. I just completed my requirements slowly as I was focusing on the international studies. And I studied abroad. And when I was abroad, this is a long story short to say, you know how they say long story short and then you go long? So then when I studied abroad, so that was an opportunity for me as a young adult to use my skills that I had learned as far as in my international studies major. I studied Arabic for a couple years, and I was learning about like the political economy of Africa and the Middle East. And I decided to go to Morocco. So I went to Morocco for about 4 months for a program. It's a wonderful program. I'm going to advertise it. It's called the Center for Cross-Cultural Learning. And we stayed in the old city of Rabat, which is the old capital of Morocco. We stayed with the host family. It was just a wonderful experience. And as part of the experience, so we stayed the majority of time in that city, but then we also had a time period was about 2 weeks where we were taken to a very rural area in Morocco. And we were set with host families there as well. And when I was with my host family in Morocco, the son, they had 2 children. It was a family, they were farmers. So there was farmers. We were in a one-room house with pretty much no furniture and no bathroom. Like if you had to use the restroom, they would take you out with a flashlight and you would use the restroom just outside. There's not even a like latrine or anything like a dug-in latrine or anything like that. It was very, very rural. So I had that experience for a couple of weeks, and my host son, he was around 6 years old, and the host family told me that we were able to communicate in the little Arabic that I did know that he had some type of illness, and he was losing function of his legs, and he was also having some loss of function with his hands as well. And they didn't know what was going on with him, so they had to travel all day, like over 7 hours on donkey, to get to the nearest doctor to see what was wrong with him. And when they did, they came back with the lab results, and they gave the lab results to me. It's like, do you know what this is? And of course, I was not a physician, or I was not even a medical student at that time. So I looked at the lab results, and it's just, of course, all Greek to me. And I'm not sure what illness that child had. It could have been a childhood illness like a polio or something that causes that would cause that. But I had no medical knowledge. But I knew that I wanted to have the knowledge to help people like this family, and that really honed that decision for me. And I also, in my time I was there, there's a book. My dad was a Peace Corps volunteer, and there's a book that they give to Peace Corps volunteers that has, can't remember the title of it, but it has information for rural areas on how to like improve the area in different ways. So I had that book with me because I had it. Well, my dad had given to me to take with me, and I was like, I'm determined to share this information with my host family. And it had, we would go through the book every day, and it had information about, oh, this is how you build a latrine, or you should have a latrine. It should be this much deep, and we would go through different topics of that. And I was really passionate about that. And I realized I want to be in a position where I can make a meaningful difference in someone's life, but it also be concrete, like right away I can see the results, or I can interpret the results, or I can be a resource or expert in that way, so that they wouldn't have to go 7 hours, or make that huge journey without healthcare. And I just saw how important it was. So that reinforced my desire. And then once I came back, I didn't have to retake it. I got a B minus, which was not that bad, but I took the second half. I don't know what this was. It was a B minus, but that was all the trajectory and what the advisor said after a B minus. But anyway, so I took the second part of biology, and as soon as I got back, I had a new vigor to apply to medical school. And I got an A+ in my second half of the biology, which I had that low score in the beginning. And then I completed all of my rest of my pre-med requirements. Because I was not on the timeline, that schedule to go straight into med school, because I did that study abroad period and I had that little gap. I ended up having to take a year or two off between going to medical school and undergrad. But I got public health experience. I got to work with management sciences for health and do more public health experience, where I worked on, they work on public health projects all over the world, but my area was on mostly East Africa, Kenya, Ethiopia, I think also Malawi were the areas that I was involved with as well. So I got that experience, and then I took my MCAT and then got into medical school, and the rest is history as far as the trajectory into medicine. That was the trajectory into medicine. It was a long trajectory, but that was that was my trajectory.
I am always amazed and inspired when I get this response from my physician guests. You are part of a group of people that really encompass many careers in one career. You just go through life going, oh I traveled abroad. I did public health. I did international studies. And then I did all these things. And then all because of a B- and one bad advisor. I was thinking I wouldn't go into medicine, but then I thought I would ace it and then become a great human being, which I was all along, but just do even more great things for the world. I just want to say, look, it is amazing to me the trajectory of so many doctors that I speak to, that there really is nothing that you're not willing to do and that you can't overcome or conquer. And that is amazing. That is what I want on the other side of the bed when I'm in need. Definitely want that kind of person. So I am, first of all, what a story. Thank you. Everything leads to everything, right? You thought you were on a detour. You thought you were on an international studies public health detour. But indeed, those things have become integrated into the life and the person you are as a physician. So they weren't a detour. They were an enhancement. They were one of the multiple careers and specializations that get packed into our overtrained, highly trained physician workforce. So we're thanks for that story. That is awesome.
You're welcome. Yeah. And again, of course, I didn't know it at the time, but I just had to focus on what was best for me and faith and not listen to what other people may say I can or can't do, because I know it once I had that passion for it, that I'm definitely going to do it.
Yeah, there were a lot of things in your story. First of all, the impact that world events and things that you took for granted, they were just part of your life. Your dad was a diplomat. You were traveling across the world and witnessing major world events. In your child mind, they're not major world events, right? They're just what's happening. But the lifelong impact that has on what you want to do in the world and who you want to be in the world, that is a super important point in, I think, your whole story. And then the fact that we're not defined by one person, one class, especially when education is easy, you're very smart and things come to you. One obstacle can really throw you off because it's not what you expect. And I know from my experience as a young person in education, I expected the world to be fair. I just naturally assumed things were set up in a fair way, and that if you ran into an obstacle, that it was a reflection on you. But you know what? Not all biology classes are created the same, and they can be set up for failure. It sounds like they were trying to put that in everybody's mind anyway at the beginning of the class. And so I think that's an important part of the story too. I think a lot of people do a lot of great things with that innocence, that hope in mankind, that trust that people are good and the world is fair. But maturity and life experiencing, understand that that's balanced with things aren't fair. They're often not fair, and when to recognize that and how to overcome that. I think those are super important parts of the story you just told.
Thank you. And I'm glad you brought up that too, because the difference between my part one biology and my second part biology were night and day. And it was mainly because of the instructor and their intention behind the course. So the first instructor, of course, I'm sure he was an excellent researcher, but he was not passionate about creating doctors or making sure that we got a grasp of the material and that we would advance our careers. He was just explaining the information. And what we heard in class was very much, a lot of times, different than what was on the exam. My second instructor actually fought to be in his class. So I I learned when I got closer to my senior year, I learned that you can search who's teaching. There's like different website you can search who's teaching, and you can see their reviews ahead of time. And this second professor, who's excellent, Dr. Victor Courses, he is excellent. And what he did our first day, so I actually wasn't even enrolled in his class. I went to the class as a I don't know what it's called, but you just go to try to get enrolled. So I went because it was overbooked, and I wanted to be enrolled in his course because if I was going to take it again, I wanted to take it with a good instructor. And I went to the course, and there was maybe 6 people that were not enrolled, but he could only accept maybe the first 3 or so to overbook the course. So I went in there early to be enrolled in his course. And when he spoke, the very first thing he said to all of us was, a lot of you want to be doctors, and it's one of the most noble professions that you can do. You get to help a lot of people in different ways. And, he was just very inspiring and hopeful and encouraging, even in that first day. And I was like, I know I want to be in this course. And luckily, I was able to join that course and have a completely different outcome. Of course, that wasn't the only course I did, but it's just it was night and day as far as the experience. And I like that you touched on just that it's not fair, right? Because I was in his course the whole time, I would have had completely different experience than if I was in an environment where I was not invested in, I was not encouraged, or better, or even discouraged, even though I was passionate about it, right? So that environment really does matter, and it's okay to change environments or take a break or find an environment that's more encouraging.
Yeah, I think that's a great message for our younger audience, for sure. There are a lot of people out there trying to do hard things in their young life, some becoming doctors, some becoming other things. And tests are not created equal. People running courses are not created equal. You can create the outcomes you unconsciously think are the right outcomes by the way that you test and by the way you teach people. So there's just things our young audience just needs to be aware of. Follow your passion, follow your joy, and just find the right environment. We're going to take a little break with our conversation with Makda Majette and come back in part 2 to find out more about where Dr. Majette's career went after medical school and what she is doing, not just as a doctor, because like her past, she is multifaceted and involved in many things. Looking forward to part 2.